I anticipate it'll probably get worse before it gets better, but we're definitely on the beginning of the season.
Doctors' offices, urgent care centers, and hospitals are seeing a surge in flu cases, and the uptick isn't uncommon for this. But healthcare officials and professionals are treating people sickened by another bug as well. 7 News reporter Ann Maxwell spoke with doctors today about what's going around and how you can protect yourself. And she's joining us live here at 7 on Main. Ann?
Amy, these doctors say they've been busy and they don't expect to slow down for a while.
Some deep breaths, right?
Between the flu,
Fever, chills, body aches,
and other viruses, doctors' offices have been busy in recent weeks.
Today has been crazy for respiratory infections.
Upstate doctors say it's common to see a lot of people with the flu and respiratory issues this time of year.
Over the past month or so, we've been getting flu almost every single day.
He says flu season typically peaks in February, and it's not too late to get a flu shot. Mission Health in Asheville is asking patients' family members to limit visiting them in the hospital because of an increase in flu activity in North Carolina. Viruses affecting the upper respiratory system have also been an issue.
So, how are you doing?
Better.
Dr. Emmanuel Sarmiento says the cold weather doesn't cause people to get sick, but it does create a friendly environment for viruses.
Number one reason really is the viral infection are spread more during cold weather because people congregate together.
He also says that viruses replicate more easily and survive longer in cold weather. For most viruses, doctors say you just have to let them run their course, but there are remedies to help ease flu symptoms.
Testing for the flu is important because we can treat flu if somebody presents within 48 hours of flu onset. The medications can help shorten the duration of symptoms for that.
With the flu and other viruses going around, one of the most important things you can do to protect yourself, aside from getting a flu shot, is washing your hands.
A spokesperson from Greenville Health System says they have reported a slight uptick in the number of positive flu cases they've seen as well.
I can tell you I was at Spartanburg Regional on Friday night for an emergency situation in the ER. They had the masks available that you could put on to avoid getting sick. How do people know it's the flu and not some other bug going around?
Dr. Hurst said that there are tests to see if you do have the flu, and he says it's really important to get that if you think you might have it, because as he mentioned in that story, there are things they can do to make it not quite as terrible.
All right, well, we will keep people posted on the developments as this flu virus spreads this season. Thanks, Ann.